Hi, this video is the art of hair transplant restoration surgery on a Caucasian man who has a receding hairline corner and on the temple as well. I'll go to recreate the hairline. Creating the hairline is very meticulous. It requires a lot of details. It is an art form. Require a lot of the artistic and aesthetic details to ensure a very natural result. On average, from the mid-eyebrow to the hairline, for Asian and black around 6.5 to 7. Caucasian is somewhere around 7.5 to 8.5. But you know, we use the average height ethnic hairline as a guide, but really when we build the hairline, we build it according to each individual facial structure. Make sure it's overall proportional to the face. And again, for an art form, everything got to have nice symmetry. So for this client, actually from the mid-eyebrow to the hairline, the median is around 7 centimeters. And because it's a third proportional, from the mid-eyebrow to the hairline is a third, from the mid-glabella to the tip of the nose, a third, tip of the nose from the bottom chin is a third. And then because of his temple gone back, so he has more like a V-shaped look because the forehead is wide. And if we just lower the hairline without bringing the temple, it's still not going to be perfectly aligned. If you look on the side, his temple has gone back right here. So we actually brought in on this side is one thumb, on the other side is actually a finger. As long it's equal, so I did from the midpoint to the side. I measure, make sure both sides are even. Once we bring that in and lower the hairline, it really shrink the forehead and really make, now instead of a V pattern, actually more of a straight symmetry. And then once you get that, it frames the face more better. And once the face is framed better, now instead of people focus on the forehead, it actually enhance your eyes, your nose, and all the features that God created for you. And that's a great thing to, especially if you notice when you wear a hat and those stuff, your look change quite a bit. Why? Because where the border of the hat, they actually frame the face a little bit better. Same thing, similar. We lower the hairline, except the hat can't create the temple. So with the hair, we do that. And we will zigzag through, no hairline straight. And zigzag has, we have two types of hairline. One's called the soft hairline, quite a bigger zigzag. And then the tight hairline, which is the smaller zigzag. And again, we don't want to do too small where it looks like it's appear as a straight hairline. So, you know, it depends on the client, whichever they opt to want to do the soft or a small tight hairline. If you don't tell me, I'm just going to go in between that. And once we get the preference of the hairline, we will try to find a very precise angle, start on 35, 45 in the front, increases when you go backward, and changes when you go a different direction. The temple hair is really flat against the skin and backward. The temple hair, then it leads to another idea of selection of hair graft. We try and find rows and rows of single hair graft in the front, followed by a root to go 2 hair, 3 hair, and 4 hair in the back for bulk and volume. On the temple, not just the angle flat and pointed backward, but mostly the temple hair are single hair graft that go is very soft. And we try to mimic the temple soft hair by selecting the root, the finest root. And again, even the finest root in the back is still thicker than the temple hair. It's just on your body, on the back, we just do not have it. And thus, if you're born with a very soft hair, the temple hair will look more fine, more natural. In either case, the way I do it is still going to look very natural without much detectability. And then the blending effect. And the blending effect is this. Where the ball area, we don't just transplant up to the border. We want to blend it in. Blending will lead to more, natural look, so it won't look like have a demarcated line, and that's lead to reinforcement. The more hair you put in, we go further in, and not just blending, we further go back. And to anticipate the future hair loss, we will transplant hair in there as if there's space provided. And then once the existing hairs are thin out, then you have to transplant take its place. So the more hair you put in, the more reinforcement we do, the less likely you have to come back. And of course, the better density. So this is the art of hair transplant restoration surgery. We'll be attempting to do at least 2,300 grafts. Thank you.